503. The first cancer is called leukemia. Leukemia is a cancer that a lot of time you see it in children, but you also see it in adults too. All right? Leukemia. On the box on the top, look on the top. Box 42-8, page 503. There's different type of leukemia, which is very big on NCLEX, and I want to clarify that. Ready? The one that is ALL, acute lymphocytic leukemia, mostly seen in young children, less than 15 years old. Put NCLEX next to that. It's called ALL, less than 15. AML, you see it in young people, 15 to about 45. Your books say 39, but I'm going to tell you, you see it from 15 to about 39. Okay? 15 to about 39, that's what the book said, but 45 in real world. Okay? All right. How many new faces I have? Raise your hand if today your first day. 3. All right. Okay. So let's go. Then we go into CLL. NCLEX. CML. Pardon. CML, you see it in older people. CLL, also older people. So listen, for NCLEX, anytime it starts with a C, seaweed, you see it in older people. A, kids. Don't ever forget that. Okay? All right? Leukemia. Now, Miss Sonia, what is leukemia? Leukemia, I will teach it in 2 classes. Peds blood and med-surg cancer. It is a cancer. Right? That is what leukemia is. Now, Miss Sonia, explain it to me. Well, here it is. This is our bone marrow. In our bone marrow, we have 3 rooms. The first room is WBC, which is 5 to 10,000, and its job helps with infection. True? The second room is RBC, and it helps with anemia, and RBC is about 4 to 5 million, right? Then you have platelets, which help with clotting, right? And it's 150 to 400,000, right? Now, leukemia is a cancer of the bone marrow. But what is this cancer is where WBC is overproducing. They call it is immature, meaning it's working too much. So if WBC working too much, it's working too much. WBC working too much, it makes the others don't work. It's not because the problem is with the others. It is the problem with WBC, and it prevents the others to work. Now, if the problem with WBC and WBC helps with infection, that means this person will have high fever. This patient will have pneumonia. Well, this patient will be weak, anemic, not because the problem is with RBC, it's because WBC ashita sitting on RBC, and RBC cannot do its job. So this patient will be anemic. This patient will be bleeding. Platelets not working. So nursing intervention is neutropenic precaution because of this and because of the chemo. Because it's cancer. Right? So look, the disease causes infection. When I give the chemo, cause infection. So neutropenic precaution, dress like you're going to the moon, no fresh fruits, no flowers, right? Safety precaution, because the patient is weak. No stick stuff IV, right? Because platelet is what? Low, because WBC is overproducing and sitting on what? The platelet. Any question? Row 1, any question? On leukemia. Row 2, any question? Row 3, any question? Leukemia. Row 4, any question on leukemia? Any question? I told you what is the disease? Cancer. What is the treatment? Chemo. What the labs that affect it? They can ask you a question of WBC. They can ask you a question of RBC. And they can ask you a question on platelet. I told you who gets the A's and who get the C's. This question in NCLEX, they can give it to you in pediatric, and they can give it to you med-surg cancer. Now, let me bring you from last week. You remember we did renal drugs? Renal drugs. There were 3 drugs in a little box. I told you we give. What is their name? Neupogen and Lumeda. They give to them. Because one is for WBC and one is for bleeding. Yes, sir. Question. Sir, question.
You answer it.
I answer it. Any question? A, can nursing intervention. Tell me, what's nursing intervention? Neutropenic. Look, watch this. Listen. Watch. Because you understand the disease, nursing intervention, you able to answer it because you understand the disease. It's a cancer of the bone marrow. What's not working? The WBC overproducing. So it's sitting on RBC. So they can ask you a question on WBC. They can ask you a question on platelet. They can ask you RBC. They can ask you a question on neutropenic precaution. They can give you on chemo. It does not infection control. It does not matter. You're able to answer it because you comprend the disease. You tell me because you understand. Tell me the prior infection. Why? Because the problem is WBC. What else? Anybody ask me a question and watch you answer it yourself. The key is you understood the disease and whatever NCLEX give, wapamasi, because you understand. Yes. Yeah, they go, good. Oh, Robin. I'm going to tell your mama, you doing better. Listen to what Robin said. Couldn't they give you a blood hanging question? Why? Why? Because of the RBC or because of the platelet? Of course. You see, they can go anywhere with you. A culture question. Jehovah Witness people don't get blood, they get what? Ecogen, procreate. I can ask you a fundamental question, a PEDS question, a hygiene, safety, a nutrition question, what else? I didn't know. Positioning. Position me. Why would you? Watch. I need somebody to give it to me good. Can they ask you an EKG question? Yes. Why? He's getting blood? He's getting not clot, Mom. I got that. Give me better.
The blood is fighting.
No. EKG. Let me see. Oh, bon Dieu. Ooh, let me see if I have a thinker in here. I don't have 100 to give this week. Last week I gave 100. Not today. But Jesus, who can tell me why EKG can be given here? The blood too thick. That's too many WBC. Come on, Stu. Okay, stay there. But why? Yes, they'll put a heart monitor. All right, let me help you. It's a cancer. You get chemo. Chemo causes nausea and vomiting. So when you vomit, that's what you said. She was the closest. Because not of the disease, because of chemo. You think? Okay, keep thinking. Yes, that's true. No, well, she said when the patient gets blood, listen, there's something she said I want to clarify. It's not every time you get blood, your potassium goes high. That's not what Miss Sonia said. When you get blood and you don't hang the blood on time, that's what I said. All right. Because the blood lice. That's what gives you the potassium problem. I mean, Sonia didn't say every time somebody getting blood, they got potassium problem. Remember, Miss Sonia said you got 15 minutes to hang the blood. So you go get it from the blood bank and you let it sit 30 minutes. Then you go hang it on her. It becomes to what? Okay, that's when you have potassium problem. Give it to me good.
What if you give the blood too fast?
No, if you give, okay, answer that. If you give the blood too fast, overload. Come on, what else? Give me, if you give it too fast, it's fluid overload. That will not cause potassium problem. Yes?
For the burner or cancer of the burner, how are you going to give blood if you cannot stick the patient?
You baby, you can stick the patient to put one IV, but keep Z-Track. Wait, now, this patient is anemic. You're going to give them iron, but with a straw PO. You're not going to do Z-Track because the patient at risk for what? That's what I'm saying. It's not don't put one IV, mommy. Don't keep ennuyé patient PK every 5 minutes. Rectal temperature, bagay sayo, they risk for bleeding. It be one thing too, their mouth will crack because of the what? Guys, you gotta think. the disease is a problem. Chemo. Who do you see? You see the little girl St. Jude Hospital? She bald because of the chemo, and she walking with the pump. No hair. The pump, that's antibiotic. Because the problem is what? WBC. And what? Don't forget, y'all forgot yesterday's stuff. You're so focused on the cancer, but what happened to the chemo from yesterday? You gotta remember, when you study in med surg, I need you to do the disease and the drugs. Yes.
It's a patient has a critical hemoglobin like 7.
Mm-hmm.
So they should have
7 or lower.
lower. They should have blood transfusion. So if they don't, they will kill them. So
Anytime a patient refuses blood transfusion, you must call the doctor. A lot of times the doctor will talk them into it.
so if they don't, if they still refusing, they don't want it. So
You call the doctor, he'll handle it. Always, always. Anytime a patient refuses blood, you must call the doctor.
So what they gonna do that patient?
No, that don't have fake blood. Trust me. The doctor will, because the doctor gonna explain this is life and death. Life and death. Now, if the patient say, I don't want the blood from people, then the doctor gonna say, okay, let's go get your family members, right? And the doctor will just explain them about Epigen and Procrit, which is the same. Yeah, but the doctor forces it. Sometimes they put them to sleep and do it. Yes, Epigen doesn't have the guys. Remember, it is a watered down blood. It has some side effect. What is the side effect of Epigen? That means y'all didn't study renal. That was in renal drugs. What is the adverse effect of Epigen? Who study with me? Meaning, what I do the week, that's what you do. If you can't answer this, that means you're not studying with me. What we just finished renal last week. Look, everybody got to get in the book. Look how we looking in the book. You should already know. Hypertension. If the hematocrit increase so fast, you remember we give Epigen and Procrit, right? If we give it with hematocrit 30, what should her hematocrit be tomorrow? 30.01. If her hematocrit go from 30 to 33, that means there is a what? Adverse effect. Her blood pressure is so high, she can stroke out. We talked about what's going on. Where's the med surge? We did that last. Why y'all looking at me all sideways? We did this last week. Should I find the page? Right? We did that last week. Last Wednesday. Okay? Okay. Second cancer. Lymphoma. Right? Lord. Hodgkin's, non-Hodgkin's. Now pay attention, because you're going to ask a question on this one. Hodgkin's or lymphoma. Lymphoma. Lymphoma means lymph nodes. Creole, yo le sayo glanio. La, kote lo gen fier yo. Fever, here, right? Now, when they say lymphoma, it's cancer of the lymph nodes. Keep that in mind. Right? Now, there's two types of lymphoma. Hodgkin's and non-Hodgkin's. Now, here's the problem. Rose pregnant. Robin, come here. I want y'all to see this. Come, little one. Right? So look, watch. Hodgkin's. Look at me. Hodgkin's still a lymphoma, has 4 stages. Look at me. Hodgkin's. I didn't go to non-Hodgkin. It first starts here. 1 lump. And it's dancing, painless, on boule. It starts here. Stage 1. Stage 2. She get another one on the same side. Stage 3. She get both sides. Stage 4. It spread to the organs. Again, lymphoma has 2, Hodgkin's and non-Hodgkin's. Hodgkin, stage 1, 1 boule, painless. Stage 2, 2 boule on the same side. Stage 3, both sides. Stage 4, spread, Hodgkin's. Any question? All right. Non-Hodgkin's. She got multiple boule on one side. Stage 2, more multiple boule. Stage 3, they both sides but bigger. Stage 4, to the organs. So you like, wow, that's confusing. Here it is. Because they know it's so confusing, the doctor will do a biopsy. He's going to do a biopsy, which he's going to take a little piece of tissue and they're going to stick it under the microscope. As soon as he sees a cell called Reed-Steinberg cell, he knows Robbins have Hodgkin's. Again, lymphoma, there's 2 types. Hodgkin's, non-Hodgkin's. Hodgkin's, 1 boule. Stage 2 of Hodgkin's, another boule. Stage 3, both sides. Stage 4, spread to organ. Hodgkin's. Non-Hodgkin's, multiple boule over here. Stage 2, it gets a little bigger. Stage 3, side. Stage 4, it's spread. So really, Hodgkin's and non-Hodgkin's look alike. So they say, hey, let me see what Robin has. He ordered a biopsy. Then he goes under a scope, and there's a cell he looked for. Reed-Steinberg cell. That tells you Robin have what? Hodgkin's. Any question? Sambakabali. Easier than that. Kazi. Creole. Right? I can't give you no sweeter than that. Any question? And it's cancer, you going to give what? Lindy. Thank you, ma'am. Any question? Row 1. Yes.
But the Hodgkin, one
It always starts with 1 painless boule.
but after the second and the third stage, it's great. So the bull there disappears.
No, the bull don't. This bull here. Shh. Guys, please be quiet. 1 bull, Hodgkin, right? Then stage 2, it grows another bull. Stage 3, come here. Stage 4, it get to your organ.
So they are good.
No, it metastasize. What? Yes, they go away parce qu'ils invade the body. That's what she had.
If the person have one, can we do the radiation?
Listen, if the patient have one, can they do the radiation? Yes, but when they gotta test it to see what you, okay? Yeah, hold on. Yes. What tell me which Hodgkin's? Guys, hey, be quiet. Okay, Hodgkin's or not Hodgkin's? Hodgkin's. Shh. All right, now you're pissing me off. 1, stage 1. Well, you can eat dances. It's non-tender pains. Stage 2, even D. Stage 3, to lay D. 2 here, 2 here. Yes. Non-Hodgkin's, bulio. Non-Hodgkin's never one bull. It's always multiple. Yes, question.
I wonder if lymphedema occur on that cancer.
No.
Cancer.
Lymphedema do occur there, but lymphedema normally occur when you remove any lymph nodes. And that is why, to prevent it, you always raise the, wherever part of the body that the lymph node removed, you always elevate it to prevent that. It's not only this cancer. Anytime you remove lymph nodes, mastectomy, this cancer, anytime the patient at risk for lymphedema. Okay? Yes. Ah, you tell me. Listen to this. I want you to ask good question. Ooh, Robin, I'm gonna call your mom. Listen to what she said. She said if she has stage 1 Hodgkin's, will they do radiation? External. Remember, there's 2 types of radiation: brachytherapy, sealed and unsealed, and external. Think, Miss Sonia, where will they do external? It's wart. See, you don't see wart en créole. Mole, sin. No, they will give this patient radiation. They will give the patient, they will give the patient chemo. They give external, no sin, skin cancer, they will have wart, mold. No, but ça semblait dans le. Yes.
Can you do surgery for stage 1?
Chemo, baby. Chemo. When they give you chemo, it should go down, and then if they have to do surgery, they will remove the lymph node.
Because what the woman said that they always say the best thing is recording early and then.
Catch it early, but you can't catch it early if you too late. So chemo is the best bet. All right? Do you understand what? Now, can the doctor do radiation too? Of course, but it's not the best. But you need chemo. Just, guys, the chemo is the safest just in case by the last spread. You want to give them chemo just in case if it's spread. Any question? We cool? All right. Then, so make sure we know that lymphoma is on page 504. Then we go to multiple myeloma. If you want to see, you see, as you study it, you see, look, you put check. You see, neat and organized. You do it, you do your chemo with it. You got to know the different type of cancer, right? Now, then we go to multiple myeloma. Myeloma, muscle, bone. Now, this is cancer of the bone. Now, I'm going to close my eyes to do this, and you who did electrolytes with me, you going to close your eyes and we going to do this. First of all, where does calcium live? All right. So, Calcium lives in the bone. How do this patient know they have this cancer? They don't know. The first thing they will do, they will fall, keep falling. So the doctor will think they have what? Osteoporosis. So guess what he's going to do? Every day he's going to give which medication? Fosamax, Boniva, right? Because remember, we did osteoporosis, multiskeletal, right? You weak, you fatigue with osteoporosis. But osteoporosis, you don't have a fever. Here, she will have a fever. So listen, she falling, she got kidney problem, because remember, calcium move. So she mimicked osteoporosis, but it also comes with a fever. Then the doctor will say, oh, okay, let's do a DEXA, which is an osteoporosis test. Her DEXA going to show she has some bone issues, right? She has some bone issues. Now, girl, go home. You working? All right. Then it's going to show she have bones issues, right? Now, there's something the doctor going to do for her. He's going to order a urine and a blood test. When he ordered the urine and the blood test, he's going to find something in it. And it is called Jones protein. When he finds that, now you are diagnosed with multiple myeloma, cancer of the bone. Who normally get this? 50-year-old African-American female. They don't know why. Very big. Ready? So, yes. Yes. Fosamax is not long-term medication. You got to eventually be weaned off it. Because if you on it for a long time, it may affect your kidney. So you got to be able to exercise. See, you on Fosamax, but what you have to do? Take calcium, walk, right? Exercise, weight-bearing exercise, whole life change, no smoking. You got to do some things, right? But they don't want you to be on it for life. All right? Because the person will have kidney and liver problems. So let's go. What is it? Number 3, right? Well, first let's get it from description. A malignant proliferation of plasma cells and tumors within the bone. Or in excessive number of abnormal plasma cells invade the bone marrow, develop into tumors. It destroys the bone. The invasion of the lymph nodes, the spleen, and the liver occurs. The abnormal plasma cells produce an abnormal antibody, right? Protein that is called the what? Jones protein, right? Now, go to data collection. The patient will have bone pain. And then osteoporosis upagendule. Osteoporosis wasn't bone pain. Remember when we did that? Wasn't bone pain, right? They will have weakness, fatigue. Yes, osteoporosis have weakness, fatigue. Osteoporosis, the patient become short. Remember? Lordosis. Okay? Recurrent infection. Highlight that. Anytime it's cancer, you always have a fever. Anemia. The Jones protein. Osteoporosis. You guys know that. Thrombocytopenia. Why? White thrombocytopenia because the bone marrow is involved.
Because all of the three?
No. Multiple myeloma, it not only affects the bone, it also affects bone marrow. And what lives in the bone marrow? WBC. This is why she have an infection too. You see that? Because the bone marrow is involved. Est-ce que nous comprendre là? Remember, osteoporosis, the bone marrow wasn't involved, so the patient did not have fever. Here, the reason this patient had fever because the bone marrow is involved. You must understand, guys, right? Any question, right? Did you go next door and tell her you here? Okay, make sure let her know. All right. Let's continue. Elevated calcium and uric acid. Where's the calcium? In the blood. Where's the uric acid? In the blood. What drug you give for the uric acid? Colishin, allopurinol. Guys, do you see the understanding? I'm not reading. I'm comprending. You got to comprehend this material. It's not reading. The stuff makes sense. You got to differentiate between the disease, right? So can I bring a diet? Which diet I'm going to give her? Be careful. Be careful. Where's the calcium? With this disease. Where's the calcium? In the blood. In the blood. So if she eat food high in calcium, that's a bad thing. So the first thing you want to give her, calcitonin, to stick it back to the bone. You got to be careful. When you have osteoporosis, all the calcium is in the blood because it left the bone. Food is not her problem. So you cannot go tell her, eat food high in calcium. Darling, she already got a whole lot of damn calcium in her blood. So the problem with people with osteoporosis is trying to get the calcium back. So be careful. Well, give her food high in calcium. Understand that, because if you give her too much food high in calcium, now she has more what? More calcium in the blood, which put her in more what problem? Kidney problem. Do y'all understand? There's a component. Our goal is to remove the calcium from the blood and push it back to the bone. Any question? Her diet? Well, yes. Moderate calcium. You don't want her to eat more. Okay, because she do got a kidney problem. Our goal is to calcitonin, right? Give her chemo, right? No smoking, no cocaine, exercise, very important, right? Give her allopurinol. Why? To remove the what? Uric acid. IV fluid of diuretics may, excretion of the calcium. Yes, let me tell you. You remember she have a lot of calcium in her what? She have a lot of calcium in her. She have a lot of calcium in her what? Blood. So sometime when you give Lasix, the Lasix will help remove the what? The calcium. Because she have too much calcium. Guys, she gonna have kidney stones and fluid, a lot of fluid. Guys, she got two problems. She got a bone problem, and she got a calcium, a kidney problem. It's because the calcium leave which is the blood. Calcium don't supposed to live there. Any question? So, how are we going to lift her? How are we going to lift her? Log roll her. Use the sheet. If I pull her, clip, her bone break. You see that? Any question? Guys, what I see, comprendre. We read, but we really don't comprehend. We must understand this material. Guys, yes, it mimics osteoporosis, but osteoporosis patient does not have an infection.
Miss Sonia, is pain there?
Huh?
If the patient have pain in the bone.
Big time pain. Big, guys, anytime the patient have cancer and do let husband and wife. Pain, yes. She had bone pain. Okay? Now, which test gonna tell you she have this cancer? Benzone's protein. It's either in blood or it's in urine. Yes. All right. Weight bearing. Now, students think weight bearing is lift weights. Weight bearing is, yes, fast walking. And when they teach them to keep the back straight, that's get doyo see. They teach them weight bearing. She could swim. She could do punches. We want strength, not cardio, right? Not cardio. It's what's the other stuff that what you call that? Aerobics. She looking for strength, right? You do cardio to lose weight. Her problem ain't weight loss. She needs strength. And not with big weights. You know how you walk with the little weights? Yes. All right. Any question? Yes. Mm-hmm. Yes. No, the DEXA is the test that we're going to see. There's a bone problem. Because the DEXA, we do it in what? We do it for osteoporosis as well. Okay? Do me a favor, push this chair in, this one in that table, under. Please, you'll see you come in. Any question? She asks a question, if DEXA, a test we use for the cancer. DEXA's not for the cancer. DEXA is used for the bone, period. Osteoporosis. Okay? Any question?
There's no stage on myeloma.
Of course, it's cancer. Always stage in cancer. Stage 1, 2, 3, 4. Always. Stage 4, you'll start walking. Every time they walk, it's pain. I had a patient, like she was so young, black woman. Ugh. She just went to the nail salon and the next day she got real bad. She died and her nails were so pretty. Like you wouldn't even think she was gonna die. She was so normal. And she died just like that. This thing spread so quick. Yeah, this lady had to be like 52, a black lady. Nice lady. Bring you back. Any question? And guys, listen, early they will give her antibiotics. The doctor can give, normally with multiple myeloma, they will start them with radiation. Because guys, you know they 50, so the doctor swear it's osteoporosis. Like he believed. But remember, who gets osteoporosis? White people, white, thin women, Chinese, Asian. It's very hard to see African American with osteoporosis. You don't see unless they smoke, do alcohol, right? But you see Asian, white, really thin, frail women. Okay? So the doctor praying it's osteoporosis. And then you see, and you die. Quick. You see African American with osteoarthritis a lot. The heavy, the hump, the butt. Okay, then, so that is, so you are responsible to read. Ready? So far, leukemia, turn. Lymphoma, multiple myeloma, and then 506, testicular cancer. Testicular cancer. One of your skills is testicular cancer, how to check for the cancer, and that box, which yesterday, 502, what the testicular one? Yeah, make sure we know that. Remember I told you that is a skill? I want you doing the green book, this one. Testicular, yes. Like, oh, in the back? No, because lymphoma is glandular. It's normally in the gland. She asked if the person have a lump in the back, is it lymphoma? No. Lymphoma normally not gland. Gland. Where gland? We're going to go fier. Right? Lymph nodes. Okay. Then we go into testicular cancer. Highlight this, and I want you to read it. I need, when I send you to read, what we gonna do? Read. Read. All right. Testicular cancer, ages are from 14 to 40. Very hereditary. If mommy, if daddy have it, 99.9, son will get it. But very treatable, very curable. Very treatable, very curable. Where does it metastasize to? Ready? It metastasizes lung, liver, bone. Very important. Number 4. Right? Data collection, it's painless. Dragging sensation of scrotum. Okay? Here's the NCLEX question. How do you know it's spread? The little boy got big boobs. Anytime you see the boobs big, that's why anytime a little boy is not on medication, your boobs so big, the first thing they check is your testicular. Unless they on medication. Risperdal can cause it. Yes. No, there's 2 types of gynecomastia. Again, the gynecomastia, you can see if it's overweight. You see, he big. There's a gynecomastia where the boob, the areola, that is a problem. Not the gynecomastia, not the weight. You can tell weight, but when the child gain weight, the black will not be deformed. When they have gynecomastia, you see, not pointy like women. Problem. When there's weight gain, the black will not be affected. It'll be big, but the areola will be normal. If you see that the boob swell plus the areola swell, problem. Any question? Okay? Now, when you have testicular cancer, yes, they can fix the one testicle and then you have it again on the other one. That is why, just because you had one last year, you still must perform testicular exam every month. And for boys, since they don't have period, we say choose the first day of the month to do it, on the other testicle, right? Even if they repair it, it's curable, it's treatable. Okay? Very hardly you hear boys die from testicular cancer. It's treatable. Now, we will do chemo and then they will do surgery. Now, students ask, will he be able to mend tomorrow, perform? Yes. If they catch it early, you have kids normal, no problem. Does testicular cancer give you prostate? Unrelated. The only thing they both have in common, they men. That's it. I don't want you to say, just because this person have testicular, they're at risk for prostate. I want you to know, anytime you have any cancer, you are at risk for anything else. Why? Because the body is tempted. You guys know what that means? Well, see, the body is already marked. Right? Imake, coagula make. You got it? All right, so let's go. Chemotherapy will be prescribed. After surgery, that's what you need to focus on. NCLEX gives you pre-op, post-op questions. After surgery and before surgery, what do you teach them? Let's go. Pre-op. Ready? You teach, look, discuss reproduction, sexuality, and fertility, because they want to know. Now, sometimes they do surgery.
I don't have pre-op, so I'm only post-op.
No, baby, no, you only have post-op. But what I'm telling you,
I'm looking for, I'm sorry.
I told you, no, you don't have pre-op on here. But what I'm just telling you, they asked you pre-op. All right.